Today's video features 10 helpful tips for a successful and quick cesarean section recovery. Some that I've always known and some that I just figured out now. So let's hop right to it. Hi guys, if you're new here, welcome, and if you're a returning subscriber, thank you. My name's Ayo and I'm a medical doctor in GP training, and today's video, like I said, will be about 10 helpful tips for a quick cesarean section recovery. And the first is you need to actually just rest. I know that there's this thing in our heads where we just feel like, oh, it's just a delivery, it's different from a proper surgery, but this is actually like a major invasive surgery that has done some havoc on your body, and your body needs time to recover from that. Not just time, but it needs that rest and recuperation that is necessary to get every effort within your body towards that healing process. So I'm going to say again louder for the moms in the back, please just rest. Allow yourselves to be waited on hand and foot by every other person, because that's what you do every day of your life. So pretending that it's not major surgery and rushing back into work doesn't mean that the healing is going to happen quicker. So the second tip is basic wound care. You don't need any fancy cream or any ritual or any oils to help with the wound healing. The body on its own naturally institutes that wound healing. There is no need for any external appliance to actually help with the wound healing, except otherwise stated so by your doctors. Some of those things actually leave room for moisture to linger that actually contributes to an infection forming. So the best thing you can do for yourself is actually just have a regular shower, allow the water run over your body, run over the wound. You don't need to scrub it, you don't need to apply some soap to it. Just let the water flow and rinse it off. And once you're out of the shower, you can always just tap it dry with a clean cloth or a clean towel. So the third tip is to support your incision. So whenever you laugh, maybe sneeze or cough, you could have this increased pressure within your abdominal cavity, and because of that pressure, it pulls on the wound, and then you have some tension that's building up, disrupting the actual line of healing. So to avoid this, you can support your incision by just placing your palm across like the incision whenever you have a cough or you have a sneeze, or even to be safer because you don't know where your hands have been, you can apply a pillow, you can apply a cloth, just to make sure that there's an extra guard when you're having any one of those high pressure activities. Okay, another thing you could do is to wear like supportive high waist underwear that does not necessarily have friction with the wound, so you don't have any problems from that side. There are some doctors that actually suggest that you wear an abdominal binder that's breathable, so it's actually not putting extra pressure on the scar, but at the same time it's being supportive. So that's something to consider and discuss with your doctors. I personally didn't quite think about the support your incision thing, honestly, like after I had my cesarean section, and I think like that was part of what actually gave rise to my cesarean section hernia forming, because of the massive bout of vomiting I had after my surgery that put extra tension on the scar. You could always check out my video on my cesarean section hernia recovery and how I did that without surgery. This fourth tip is actually funny because I think it was the tip I dreaded the most, and it's clot prevention. So we all know that because of there's a relative limitation with your mobility when you have a cesarean section, being a major surgery that it is, there's a tendency for you to be in one space, and because of that you could have your circulation slowed down and you could have blood lingering in parts of your body, particularly your legs, and this stagnancy can actually give rise to clots forming that can mobilize from your legs even to your chest, causing you to have something called a pulmonary embolism, and that's actually very, very fatal. So you want to avoid that, and this is something that tons of research has been done on, and they've gotten like a good guidelines to help prevent this with pregnant women and also postpartum women. So particularly after a cesarean section, because of this limitation, you'll probably be given some stockings, compression stockings, to help you. And I hated those stockings, but they really help. They help to keep the circulation going within your lower limbs so that you're not prone to having that stagnancy in your lower limb blood vessels. Okay, another thing is they sometimes give you an injection, and this injection is supposed to go just beneath your skin within your fatty layer, and it's supposed to also help prevent clots, but it stings so badly, and after the first one you probably don't want to have any other. But believe me, it's actually preventing you from a very fatal thing that could actually take your life. So it's very important that you actually adhere to the protocol. So if it's for 10 days you've been given the medication, take it for 10 days, you'll be okay. And if it's for 6 weeks, please take it for 6 weeks. It doesn't, like, maybe because you're mobile now, maybe because you're doing a lot of stuff now, you feel like you don't really need needed, please still do take it according to the actual policy. The fifth tip is to stay on top of your pain relief. I know that there's so much going on, and taking some tablets is probably the last thing on your mind, but it should actually be the first, because it could actually save you the pain that you're going through and make the process of recovery a lot more seamless. Most times they'll set you up on a staggered schedule for the medications, and what happens is, let's say there's one medication on paracetamol by 6 a.m. and there's another one that's scheduled to start by like 9 a.m. and the entire purpose is for them to overlap so that their effect overlaps, and if that happens, that could actually give you a pain-free recovery process. But if you don't take it as when scheduled, you don't get that benefit of the staggered dosing. So just try and keep on top of your pain relief. Another thing is that because you're pain-free, it helps you to be more present with your family and with your baby. So this is very important. So the sixth tip is to hydrate and eat healthy. When you're hydrated, you feel a lot more energetic. That's one thing. And also it helps with your circulation. Yes, towards preventing clots. But when you eat nutritious meals, something it does is that it provides you with the necessary nutrients to facilitate wound healing. Take for example, vitamin C really helps with wound healing. Zinc helps with forming new cells. So by the time you take like really balanced nutritious meals, you actually find that you're fueling your body for a quicker healing process. The seventh tip is to prevent constipation. If you're taking lots of fiber from the last point about eating healthy, nutritious meals, this shouldn't really be a problem. But with cesarean section, because of the method of anesthesia that you're given, sometimes there's a slowing down in your bowel movements. And even because of like the sort of trauma from the abdominal surgery, there is a slowing down in your abdominal movements, and it could actually end up putting you in a kind of like constipated state. So what you can do apart from the fiber is that you can also get some over-the-counter stool softeners that can help to prevent that increased pressure that you can have when you're straining, when you're constipated, because that strain can actually put pressure on the wound, like we've highlighted earlier, and cause that tension that could actually cause injury or could actually slow down the healing process. The eighth tip is to avoid heavy lifting, and this is something that seems like a no-brainer, but I find for moms, because you're trying to be present for everyone, you actually forget that you're not supposed to lift anything heavier than your baby. At least I did, and I was trying to do everything, lifting up the car seat and all of those things, and they were way heavier than my baby, and I feel like that added so much more strain into the wound healing process, because my wound healing process took weeks rather than the probably couple of days that it would have taken if I were more relaxed with the entire process. So very important, don't lift anything heavier than your baby, because that would actually add more strain to the wound itself. And also remember that you're not just healing on the outside. So it might look like your scar is all healed up after 2 weeks on the outside, but the inside is still going through a thorough process of wound healing, and any extra strain you do externally could actually be projected as pressure internally, and that actually disrupts the healing process. The ninth tip is to ask for help. I always find that there's so many people ready to help you, but because you don't ask, they don't know if they're supposed to offer the help. I remember being alone with my baby outside, and I was trying to do everything for myself, and at the end of like the entire program, someone walked up to me and was like, you should just always ask for help, because people are ready to help you, but they don't just know if you want the help. So always just be open in terms of what you can do and what you cannot do, because people just are waiting for that extra like assurance that if they offer the help, it will be received kindly and it wouldn't be taken out of context. And if you know someone that just gave birth, they need your help. Don't wait for them to tell you. They need your help. They need cooked meals. They need nutritious meals. They need someone to wait on them hand and foot. They need someone to be able to feed the baby while they go take a good nap. So please always offer help as well. The last tip is so important. So I'm a doctor, but I'm not your doctor. So it's always important that you see your doctors and you keep your doctors in the loop of everything going on. So if you notice a change in your scar, maybe it's gaping, maybe it's actually bringing out some fluid, maybe it's bringing out frank pus, maybe it looks like it's red, like it looks angry, or if maybe you're feeling a bit feverish, so your temperature is going higher than normal, or you notice some swelling in your abdomen, you really need to go see your doctors. And the beauty is, within the first 42 days, you actually get instant access to see your OBGYN, to see like them in the maternity emergency, and they'll be so happy to help you. Another thing you can do if you're out of the 42-day window is go to the emergency. They will also be very quick to respond because they know the type of complications that are common in this time period. All right then, if you have any tips that you've probably employed, maybe for postpartum recovery generally, or if for cesarean section, or even for vaginal delivery, you can leave it in the comments and I'm sure it will help some mamas out there. All right then, if you like this video, please leave a thumbs up, comment, and then subscribe to see more. Bye.